Welcome everybody to the breastfeeding class. The topic that I want to talk about today is jaundice. And one of the reasons I want to talk about it, I feel like I've been trying really hard to get it into my agenda this week to talk about it because my sister just had a baby and she was going through the struggle of jaundice. And so it made me kind of remember the feeling as a mom when your baby gets jaundice and you're afraid and you're afraid of them getting admitted because doctors, they scare us. They scare the crap out of us. You go to the doctor and they say your baby needs to gain weight or your baby is really yellow and you need to do this or this or this, and they make you panic. And so then when you become panicked, then you don't know what to do and you don't know where to turn and you don't, you just have so many things on your mind and all you want is a healthy baby. So every doctor is different. You've got doctors older schooled and then you've got the newer doctors. And the newer doctors are now being trained how to handle situations with infants and moms who are breastfeeding. A lot of times when things happen like mastitis or something like jaundice, doctors used to say, stop nursing and only formula feed. And the reason they did that was because formula feeding became the model that everybody followed. And formula fed babies tend to only get jaundice for maybe about a week. But a breastfed baby, it goes longer. So they're actually studying it, trying to decide, is it good that the jaundice lasts longer in a newborn baby and not good that it doesn't last long enough in a formula-fed baby? They don't know yet, but they're looking into it. So what I wanted to do is have this video out there for you guys, for you moms out there that are struggling with this right now. And a newborn baby who breastfeeds can have jaundice even up until they're 6 weeks old. But there are some things that you can do to limit it. Now, the very extreme cases, which are like blue lighting, putting them under blue lights and things like that, or no longer breastfeeding, just formula feeding for a couple of days until it goes down. Those are like the most worst cases. And sometimes doctors will turn to that out of concern. They want the baby to be healthy. It's not like anything in malice, but they don't really understand completely enough about what the breast milk will do for the baby, and they have to focus on scientific methods, the things that they're being taught. So we're going to talk about, first of all, the symptoms of jaundice, and then we'll talk about early jaundice, and we'll talk about prolonged jaundice. And I in no way want to minimize jaundice because it is common, and sometimes it's even common when its onset is later, or they start it normal and it just doesn't go away. And by 3 months old, it's still there. And that can be an issue. And there was one mom I knew of that she was having this problem. And it turned out, it definitely was something that she needed to do. Hold on just a second. It was definitely something that they needed to look into further because the things that they were doing that you usually do the treatment wasn't working. And it came to be that the duct was not attached from the liver to the stomach, I believe it was, to get rid of the bile, maybe through the gallbladder. I just remember that there was no tubing there, no duct. So first of all, let's talk about jaundice and the symptoms. So I'm taking this information. I actually emailed it from a site so I could print it. And then I'm going to give you the links down below because there's a lot of resources you can go to. I have 18-page resource, and I did not want to have to. I really don't want to talk about things, the challenges that could, the worst case scenarios. I want to talk about what's normal. And then once you know what's normal, then you can focus on if something is abnormal. So I'm going to be using this paper and reading a little bit from it. So it starts off with the symptoms. Now, early jaundice tends to show between ages 2 days old and 7 days old. So that first week. It's usually physiological and clears after a few days. Jaundice can make a baby sleepy so that he or she sucks less. Early initiation of breastfeeding and frequent breastfeeding reduce the severity of early jaundice. That's the really big key. For instance, my sister called me last week and her doctor was very concerned about the jaundice level and she didn't know what to do. Now, he told her to just continue breastfeeding. He did really good because he didn't tell her to formula feed. I've had doctors tell me to formula feed. And as a mom, I did not want to do it. So I did a bunch of research and I did not give formula. The research says that you breastfeed more. So what I did was she told me he was sleeping a lot, which jaundice can do. So when a baby has jaundice, that early symptoms, the early jaundice, they appear around 2 to 7 days and they sleep a lot. So you're going to have to wake them and feed them because they need to get that meconium out. They need to poop. They need to get all that stool out. And the faster that is done, the quicker they begin to recover from the jaundice. So when the point it mentions here is early initiation of breastfeeding. That means from day one, from birth. And then you want to make sure, especially what I told my sister to do is to breastfeed every hour for the next 24 hours. Well, I said, nurse every hour, even wake him up to feed because that wasn't his normal schedule. And then at night, you want to sleep a little bit. So I told her you can go about 2 to 3. Go 2, not 3. Do 2 around the clock. So the more he eats, the more poop he's going to have, and the faster he's going to get over that jaundice. So that's typically what you're going to hear from a lactation consultant or a lactation counselor or possibly even a breastfeeding peer. So you would initiate it early and you would frequently breastfeed, and this will reduce the severity of it. Prolonged jaundice starts after the 7th day and continues for some weeks. It's usually due to hormones, other substances in the mother's milk. So it is sometimes called breast milk jaundice, which is harmless and clears by itself. If the jaundice is due to a more serious condition, there are usually other signs such as pale stools, dark urine, or an enlarged liver and spleen. So if you're not seeing these more serious effects like pale stools and dark urine and or an enlarged liver or spleen, that means, that it's probably fine. It's probably not severe. It is just the normal jaundice. And most people that have jaundice, if I talk to you face to face, you're going to say they do sleep a lot. They're probably sleeping at least 3 hours. And so, every hour, every feeding, they're sleeping like 3 hours in between. And so all you need to do is increase that. And that's why they say with newborns, they prefer 10 to 12 or even more breastfeeds. Just because you're doing a lot. You're helping with engorgement when your milk increases in volume. You're making that better. You are you're telling your body, that you need milk, and you're going to build those hormones and the, I got the thought out of my head, receptors. Every time you nurse in those first day, that first 48 hours, first 72 hours, your body is building receptors. And those receptors your brain is basically putting those receptors into your breast. And that determines how much milk you can hold in your breast. So that's really important. So that early initiation is really, really good. If you're doing that, you're breastfeeding and you're waking the baby up. Now, this waking the baby up is against anything I would say as far as like normal if he didn't have jaundice. So by the time he gets past or she gets past the jaundice, then you can go a little bit longer and feeds and kind of just feed on cue when he's ready to feed or she's ready to feed. And then we're no longer looking at the clock, we're counting how many times he eats. And you want to think in your mind, okay, well, he ate at 5 o'clock, 6 o'clock, 7 o'clock, 8 o'clock, 9 o'clock, and then he slept from 9 to 12. And that's good because he cluster fed. If he is sucking for just a couple minutes and falls asleep, I wouldn't count that as a feed. He needs to be sucking longer than 2 minutes. He needs to be sucking, 10, 15, 20 minutes. We don't put a rule, but for newborns, we kind of do, just for the protection of you and your milk and the newborn growing and getting the amount of milk they're going to need and just thriving and not becoming malnutritioned. So that's one of the reasons they focus on that. So now management, how to manage these two. You've got the early jaundice and the prolonged jaundice. And the prolonged is where it would last longer than just a few days. So early jaundice, they used to send you home in the hospital with sugar water. And it was for that reason. But that doesn't help. Another thing that people, they normally send home a bottle of formula. And formula is heavy and the body can't really digest it, but it's heavier and possibly it pushes through, but it is also not the management of jaundice. The giving like a water and glucose can make a baby suckle less at the breast, and that is making a problem. Let's see. That's making a bad, I'm trying to think of it. It's making a small error into a big error because the feeding is what's so important. Taking breast milk helps jaundice to clear more quickly, so the mother should be encouraged to breastfeed as often as her baby is willing. Now, of course, there are going to be times when they're too tired, they fall asleep. My sister called me and said, I couldn't get him to breastfeed at this specific time, but I was able to a little bit later. That's fine. We just want to get him eating a lot. And if it's jaundice, I would go 12 to 14 times a day. And if need be, waking them because jaundice makes them sleepy. And if you've had medication, that on top of it can make a baby sleepy. So you want to consider those things. Let's see where I'm at. So you can, the mother, you should be encouraged to breastfeed as often as your baby is willing. So when you go to the doctor, that is what the doctor should be telling you. And I'm going to link below the American Pediatric Society, I think is what it's called, and their recommendation on jaundice. And it's that same thing, so that maybe you can copy it, keep it in your files for future use. Or if you're finding you want to, your doctor is saying formula, you can pull that paper out and show them what, that paper says. Another thing we don't want you to do is, I guess I kind of mentioned water. We don't want to feed with water. Also, what you can do is express your milk after feeds and give some by extra tube, a cup or a tube. So they've sucked for a little while and they're done sucking. Maybe they're tired out. You can start expressing some into a little spoon. I personally I wish I had it, a little medicine dropper, because that medicine dropper is exactly the amount that they need the first, I want to say 7 to 10 days. So it averages, it goes up, but they go up to 2 ounces, 4 ounces. But in the very beginning, that's all they're taking. So that's the best time to if you're having trouble even latching, to use those instead of spoons and stuff or bottles, because then that can make it a bigger deal. If you're feeding your baby on express breast milk, you should give 20% extra. If jaundice is severe, phototherapy light treatment may be needed. So if your baby has jaundice, try to breastfeed at least 20% extra than what they're normally. So pumping, at some point during the day, or when he's finished or she's finished sucking, hand express what little bit you can get out and give that to them too, because you just want them to get as much milk in them as possible to get their stomach digestive issues moving and getting that liver, all that stuff out. Again, I'll have all the technical stuff in the link. This is just the basics, okay? I just wanted something simple for you. So now we're going to look at, and about the severe phototherapy, some of that can be done at the hospital, but can also be done at home. There's a little wrap, we used to call my nephew a glowworm, because they just wrapped it around his belly and told my sister, keep him in that a couple days, every day for a certain amount of hours, and that did its job. So if it's really, really serious, then they may recommend the blue light, and you want to ask if you can do it at home, because they may just say, well, let's put you in the hospital, but the home, I'm going to look it up and see if I can find a link below, but typically medical supply companies do provide it, and insurances will pay for it. So I'll put that in the description below as well. Another really good point, really quick, is always using sunlight. Put them in areas where the sun is coming through a window, or if you're outside, it's a nice sunny day, not a hot sunny day, but just a nice sunny breezy day. You can put them out in just their diaper and kind of like hold them in the sun. You're not going to do that for a really long period of time, but try to do it for like 2 or 3 minutes all day throughout the day, and that will help a lot. Prolonged jaundice. This is where the baby should be referred to for clinical assessment to exclude a serious condition. The mother should continue breastfeeding until the infant has been fully assessed. So this is where we're talking about people that go over the normal, because, a breastfed baby, I'm trying to find where I read it, continues for some weeks. But prolonged would be in a case like, okay, my baby is 2 months old or 3 months old and they still have jaundice. And most likely you're taking your baby to the doctor and they're going to be aware of it. So if you're feeling like it's too longer than it should be and the feeding is good, there's no problem in that area, then you probably want to contact the doctor for an assessment. I would make an appointment with the doctor, and I would also make an appointment or talk on the phone with a lactation counselor or consultant. I have my email address in my description, because I am available for you to call and ask those questions. If you feel that the baby should or shouldn't go, just because you need that little backup. Sometimes you need that voice to say, yes, you're right, or no, I think you're okay. But during all that time, you do not want to stop breastfeeding. You're going to continue to breastfeed as long as possible. Now, there are some questions that people ask, and I'm going to go through this fairly quick, just so you kind of understand it. And again, I'm going to put this link in the description box so you can look at it as well. One question is, what is jaundice in newborn babies? So jaundice is a condition that makes a newborn's skin and the white part of their eyes look yellow. It happens because there's too much bilirubin in the baby's blood, and bilirubin is a substance that is made when the body breaks down old red blood cells. Jaundice usually is not a problem. It's actually normal. And it does give a link under jaundice in newborns, hyperbilirubinemia. I can't even say the word. Anyway, I'll put that link below too. The next question is, what is jaundice in a newborn? So a common condition in a newborn is jaundice refers to the yellow color of the skin, the whites of the eyes caused by this excess bilirubin in the blood. And you're not the body's not breaking down those red blood cells. Usually, the bilirubin passes through the liver and is excreted as bile through the intestines, and feeding them often pushes that out, and that's what you want. Okay, the third question, I believe, is what causes jaundice? Jaundice occurs because your baby's body has more bilirubin than it can get rid of. The reason it's yellow is that the bilirubin is a yellow substance. The reason it's yellow. Bilirubin is a yellow substance that's made when the body breaks down old red blood cells, which we just talked about, and it leaves the body through urine and stool. When you're pregnant, your body removes bilirubin from your baby through the placenta. So the more you feed, the way to get rid of that bilirubin is through urine and stool, and that's why feeding more often is what you need to do. The last question is, how long does jaundice last in babies? Breast milk jaundice can last for 3 to 12 weeks after birth, but as long as the baby is feeding well and bilirubin levels are monitored, it rarely leads to serious complications. Breast milk jaundice must also be differentiated from breastfeeding jaundice, which is jaundice resulting from an insufficient intake of milk. So there is just the normal, let's see, what do they call it? There's breast milk jaundice, and then there's breastfeeding jaundice. And so both of those have their own issues, but the best thing is to these two things are both caused by resulting from insufficient intake of milk. So just simple, it has to do with the liver and bile, and the baby when they're born does not have the ability to break that down and get rid of it. And so when they were in the womb, the placenta did it for them. And now the way that they get rid of that is through stool and urine. And if they're not stooling enough and they're not urinating, that could be lack of a good, like they're not getting enough milk. It doesn't mean you don't have enough milk in your breast. It just means they're not getting enough. In that case, I would get help. You can do things like this, where you're FaceTiming somebody, Skyping with somebody, and they can watch you breastfeeding. You can do many things like that. And so, or just being seen by a peer counselor, going to WIC if you have WIC, try to find support groups in the area, anywhere where you can find somebody and expertise in latching and feeding to see what might be the problem as far as why the baby's not getting enough of that milk out. So that is it. As far as questions go, and like I said, I will link these below, and I will add a few other things, but this is a really, really important topic. I am actually going to get this set up and upload it onto YouTube, and then I'll be doing some updating while it's on YouTube. So if you watch it and you're not yet seeing like certain links, you want to come back and look for those later, because I'm going to try to get this uploaded, and then either tomorrow or Wednesday, I will try to tweak it a little bit so that you guys, you have all the information at your hand level. So that's it. That's all I wanted to talk about with you guys today. I hope that you are enjoying the videos. I hope that you take a moment to subscribe and continue watching so you can continue learning more and more about breastfeeding and how you can be successful in doing it. You guys have a great day or night, and I will talk to you in my next video.